Welcome, everybody. So, we have all joined here together for wellness and healing for moms with special need children. Okay. I would really appreciate if you all can put your videos on. This is an interactive session. So, it'll give me also a sense that, that I'm talking to somebody and not just talking to names. Okay. Uh, Thank you so much, Ramya. And yeah. Just spotlight myself so that I get a better view. So, all right. Today we will, I'll just brief you through what this wellness circle is all about. Today, I'm starting with this wellness circle because I myself am a mother to a special needs child, and I've gone through my own journey, and then I decided to learn these modalities to strengthen myself, and I began to enjoy it. So then I learned, I got certified, and now I want to help parents who were in the position where I was and would want to feel better, although it's an ongoing journey. So I will be sharing certain things today which some of you must be already aware of. You will add on to the knowledge that you already have. Okay, some of the information will be new, some of the information would be existing. Some of the exercises that I will give you, you can use it on yourself, you can also use it on others. And apart from that, I will, there might be instances where I might share something personal, or some of you might share something personal. So if there is an instant like that, we just, raise our hands and take a note that, what happens here remains here. Although I'm going to upload these videos on YouTube, but if something of that sort comes in, I will edit that part and then upload it on YouTube. Okay. So why am I doing this? Okay, why am I doing this wellness circle? I'm doing these wellness circle because when I got certified as a emotional wellness coach. I'm a certified practitioner in a modality called emotional freedom techniques, and I'm also a breakthrough NLP coach. So when I got certified, and when I used to, invite a lot of people. To attend my webinars. I used to do these webinars earlier as well. I realized there were a lot of people who did not know enough about special needs, especially autism. There was a lot of emotional struggle. There was a theme that played with every parent, whether your child has autism or not. My child has autism, so I've studied more about autism. But even if you have any child who's on special needs, um, there is a theme, the child goes through the struggle. The parents are always, the moment you find out, okay, the child has an issue, we are, we do everything in our possible capacity to support the child. In the process, we tend to ignore what are our emotional struggles, where have we not accepted things, what are our emotional baggages, and then to, learn everything completely new, unlearn, what you had learned since childhood, learn a completely new approach to deal with your child. It's a lot of emotional trauma and baggage. So some part of these webinars, I will take up a topic like, sensory issues, IEP building. IEP is individual education program building. Then primitive reflexes, behavior management. I will pick some of these topics in every week, and I'll discuss a bit of, what I know already about it. And I will also take inputs from y'all that, what would y'all like me to cover? What are some of the topics that you want more insight on? So apart from that, once a month, mostly, I will invite an expert also who can, give information on the basis of the knowledge that they have, the expertise that they have. And so that our knowledge about, the condition of a child improves. And also we work towards our emotional wellness so that we are in a better space to deal with what our children are going through. Yeah. Um, so I'll start with my story. I'll begin with my story. I am actually a qualified computer engineer. And when I got married, I was absolutely clueless of what I wanted in life. I always wanted to do things that will make others happy, that will, keep others pleased. In the process, I absolutely forgot what I wanted or what I really was. Then, when pregnancy happened, it was a very difficult pregnancy. I was on bed rest. I was conceived with twin children. And when children came into picture, I was quite, you know, devastated. I would say I was not in a position to actually handle both kids. By the time they turned two, I thought I'll go back to work, but I realized that one child is on the autism spectrum. So the moment I realized one child is on the autism spectrum, I went to the doctor. The doctor asked me to go to the therapist. I was in complete denial. I was like, I have twin children. I've not paid attention to one. I've paid more attention to the other one. So probably that's the reason the other one is behaving a bit erratic. And the developmental pediatrician understood that I was not in acceptance. So she told me that, you go for therapies for 4 months. And if your child has nothing in 4 months, it's all going to be done. When I went to the therapy center and we started with the therapies, I saw there were more kids who were coming there. And they were coming there since few years and they were still where my child was when he started his therapies. That is when I realized that, this is something that I'm taking too casually and I really need to deep dive into it. So I began studying about autism. I began, reading more about what developmental delays are. I began reading more about. Uh, so there were issues like I was acceptance was a huge issue. I couldn't understand if I was wrong somewhere or did some of my family members went wrong somewhere. Then there were so many things going on in me. Every time I would come up with a question, I would search something on the internet and read about it. In this moment, what helped me the most was that, I came across a lot of mothers who were in the same circle as I am, and they have children who were elder to mine. So they guided me, So that was the biggest support that I came across. So when I found people who were in the same boat as I am, I kind of, I started feeling that I'm not the only one who's going through this. I began to feel that I have a community, I have people who are like me who can understand me. So I formed some very good friends also in that process. But even when after a point, after I formed a circle of friends who were in the same boat, I realized the stress was not getting over. The stress of learning new techniques for your child and then applying it on your child and then reaching on school at time, therapies on time, and trying to feed your child at the same moment, not able to feed your child completely. Then the meltdowns are also happening. So it's a complete learning process for the parent, especially the primary caretaker, and also for the child, right? Matlab, you also need to learn completely what the child is going through. And even though I had a community of friends who were going through the same thing, the family members and people who we would live with, they were also clueless how to support us. So the stress was not going away. The mental stress that was playing beneath was not going away. And then I realized I needed help. So I went and I came across, a therapist who was doing emotional work, and I started, taking sessions from her. And after a point, I felt, instead of going to somebody, why don't learn it for myself so that I can help myself instead of running here and there and every now and then. When I started learning it for myself, I got so passionate about it that I became certified and I learned a lot of modalities that help parents, or it helped me also. I worked on myself also a lot, how to become emotionally balanced, how to balance two children who have very varied needs. One is like a neurotypical child who needs everything as per the regular world and the regular requirements. And one is a neurodiverse child who needs everything, just not as per the requirement, have to be okay with it. So, even if he's 10 and he's still in senior KG, it's okay. So how to deal with that? These things don't come easily. We cannot accept these things. And that's when I started taking therapies, learned therapies. I worked on myself and now I do this work. I do it professionally. And I also do these webinars because I want to create a community where we can support each other. Because, as a parent of a special need child, there's so much that we go through. The child also goes through so much. The parent also goes through a lot. And it's the daily struggles that makes it really difficult. So if you don't have anybody else where you can, talk to or vent out, for the simplest thing that, my child threw the glass today, I had to clean it 5 times and I really lost my head. Okay. So something like that, if you go and tell it to a random person, they will not understand. But when we have a community of people who are going through the same thing, there is empathy, there is support. So my purpose of, having these circles is that, and also information sharing. So I would really encourage you all to, post your questions on the WhatsApp group, ask questions here as well, and tell me topics that you would want me to, cover. Could be related to sensory issue, could be related to anything that you think that my child is struggling here. What kind of a behavior is this, or any topic you feel that you need more information on, let me know and I'll try to bring on those topics as much as possible. Yeah. Okay, so I want some interaction, please. Yes, no, thumbs up, thumbs down. Am I on track? Am I boring you all? Please. Okay, great, thank you so much. So, yeah, so moving on, I mean, if there are any questions, anything you all want to ask, please go ahead and unmute, because we are very few of us. Please unmute and ask me anything that you all want to ask. Yeah, Niharika, do you want to say something?
No, I joined late. Sorry, joined just now.
That's
So
okay,
did
not a
I miss
problem.
something?
No, I was just talking about what these webinars are going to be about. So we are going to, I would request you all to ask questions, tell me topics that you would like to cover, because these are going to be short sessions and I'm going to cover it every week. So I would request you all to, bring in topics. And then when we discuss a certain therapy method or certain, topic, we'll also discuss the stress that goes around that topic, and we'll work on some stress release exercise at the end of the session. So right now, I really want you all to, speak up, share anything that you want to, uh, ask any questions if you have. And, any question that you have, you can just put it here, so that, you might have a question, somebody else also might have might also have the same question. Yeah, sweetie, tell me.
Yeah. Hi, Sonal.
Yeah.
Sonal, I would like to know how to, train our kids on like dressing up themselves. My kid can undress himself, but dressing up is still a challenge for him. So,
Okay.
if other parents have achieved that, I would like insights on how we can go about it. That would help.
Have any other parent achieved this? Anybody wants to share?
It's a work in progress for us. Like if we make it properly and give it to him, he can put on, but he can't differentiate if it's ulta or if it's inside
Yeah,
out.
that is the problem I am also facing, right? Because there are two things. One is ulta sida and other is, back and front.
Mm-hmm.
Yeah,
So
so these are,
So,
my
yeah.
son is paying attention. He can tell like which is back, which is front, but most of the time he'll just try to, without seeing, he'll try to put the dress. So that's an issue. And otherwise, like if we make it properly and give it to him, he can put it on.
yeah, right.
Anybody else has the same issue? Or anybody else who's achieved this? Okay, so,
Because
sweetie,
my
thank you
son
for.
goes to school and I advise him that if you go to washroom, you should not come, without wearing your
Hmm,
clothes.
hmm, hmm,
So the
hmm.
point is he'll wear, but he'll wear ulta and matlab, you cannot be sure that he wore correctly, and he will be roaming like that.
Oh, okay, okay.
That is a
So,
problem.
sweetie, thank you for asking that question. So, to be really true, my son is also pretty much on the same stage. What has helped is, like, repetition. This is something that
Hmm.
we need to be patient with, and repetition needs to happen. Of course, when they are alone, I mean, you can't really help much when they are alone, as long as they're wearing it on their own, right? But when they are with us in the house, then we can make sure that I use a lot of visual schedules to make
Hmm.
him. Then you can see, for instance, for my son, there is a particular brand's pant where he can automatically differentiate that this is front and this is back. So I would prefer to use more of those pants, so that it's easier for him to recognize. And then with the underwear also, I use the underwear where they have an image in the front, right?
Okay.
Mhm.
So then constantly telling him, and now he's able to make out. So still he needs some prompt, but he is slowly able to make out. So repetition is one thing, visual schedule is the other thing. Like, you can make pictures. and you can actually show it to him that this is how you wear it, put this in the front. You might feel that he's not getting it, but they do pick up, slowly and steadily they do pick up. For
No,
instance,
if you ask him which one is front and back, he will say. But when asked to do it, no, he would just hastily wear it without bothering.
yeah, that will come with time. That will come with time.
Yeah,
My son
right.
also, he does, he also knows how to make it seedha, but I have to prompt
Ah,
him. If I don't prompt him, he will wear ulta. But
yeah, they
it's
just want to
slowly
get done
coming.
with. Yeah.
Yeah, they're still getting it so slowly. So, in such cases where, we are struggling trying to teach a particular thing to our child and the child is not getting it, okay? What I do generally, I tap onto my frustration first. That what about, my child not getting this technique even after me trying to teach him so many times is bothering me. So I generally say that, I get really irritated. Or how many times do I have to do it? So then I use therapy methods where I would, tap on myself and say that even though my child is feeling really, my child is taking too long to understand such a simple thing and it's taking so much of my time. Even I end up saying stuff like, how many more days have I do to I have to do this, how many more days I have to scoop it and I give it to you. Can you do it on your own? I lose my head at times. But then, in those moments, I take a step back and I try to understand where is it that is bothering me? What about, my emotion is getting triggered? And I try to address that emotion before jumping onto my child. So when I feel settled in me, that he's taking a little longer. It's okay. Let him take his time. Then I see that my son is also cooperating better. And I see that, the struggle that he's, एक तो struggle है कि
That's very, very true. Yeah.
yeah, the
Just
first struggle
I am
the child is
taking
facing. Yeah, the
like
first struggle that the child is
that I
facing
get
is yeah. Okay, go on.
dysregulated.
Yeah, go on.
No, the thing you're saying, even I get dysregulated. Like when my son is dysregulated, sometimes I become more dysregulated. So
Yeah,
it becomes difficult for him also. Like it's very difficult to cope up then.
correct.
What you're
That's true.
saying.
Yeah.
I don't know what to do in those situations, and
So
like I
see,
get very
what I was saying was that the first struggle is that they are finding it difficult to understand so many things. Ulta hai, seedha hai, and all that. They need time. They need time to process. Number one, and a lot of times it happens that you have to go for therapy now. 5 o'clock, the therapy is there. For 4:45, your son is still trying to figure out if it is ulta or seedha. Okay,
Mhm.
you lose your head. So, but the child also, senses your anxiety. That okay, I am still finding it difficult to process this, and she's running out of time. This is too complicated. Let me just get done. Let me not put in too much of thought in, whether this is ulta or seedha. So, in that moment, the difficulty which is there, my anxiety adds on to the stress of the child. So, I need to first settle because see, after all, I'm the caretaker, right? So unless and until I give the child a supportive environment, even if it's getting 5 minutes late or 10 minutes late, the child is not going to feel confident enough to come up that yes, I can take my time and I can do this. Yeah. So a lot of work requires here. Where am I getting triggered? What are my struggles when I'm trying to teach my child a certain behavior? Okay, and that's why we've gathered here so that we can address that part. That when my child is behaving so and so, what do I do? How do I relax myself? How do I support my child better? Yeah. Any other questions? Any other? Ramya, do you have anything? Yeah, go on. It's Trupti, right? What's your name? It's saying Samsung. So yeah, I can't hear you.
the mute.
Hello,
Yeah. Who's this?
Ramya.
Yeah, Ramya. Tell me.
Yeah, I just wanted to ask the other person who was just talking about how old is her son? Because mine is 16-year-old and he has learned to wear his dresses properly, but still he struggles with that inner wear, what you call it, briefs.
Yeah,
वेस्ट
yeah.
ना
Mm-hmm.
वेस्ट वेस्ट बिकॉज वो वाइट होता है उसका आगे पीछे हाइट वो ही स्टिल स्ट्रगल्स विद दैट बट अदर देन दैट एवरीथिंग ही मैनेजेस हिज ओन The main thing, just as you told me, printed t-shirts. He knows prints comes in front, तो वो गले में लगाएगा, लगाने के बाद घुमाएगा 3 बार. Then he'll check whether the print is there. If the print is there, then he'll put the hands, sleeves.
Okay.
So that's how he manages. And जो the knickers and all, sometimes उल्टा हो जाता है. But that time also it's like अरे यार नहीं, ऐसा नहीं होता है. ऐसा होता है कि अरे तन्मय ये तो उल्टा हो गया. That way. So then he's like उसको वो डर नहीं लगता या फिर वो नहीं होता है. Then okay, it's wrong. Can we make it right? Then he says yes. Then okay, remove. Then wear it again. So he's 16. He's still figuring out, but manage करता है, अपने आप manage करता है, अपना dresses choose करता है, individually पहन लेता है. Shirt, T-shirt में problem नहीं है, अंदर वाला जो होता है उसमें थोड़ा सा issue है उसको. So I just wanted to ask her कि age क्या है? Age के साथ में बच्चे कर लेते हैं, and as you said, repeat and every time when he once अभी भी जब यूनिफॉर्म पहनता है तो पहले जो व्हाइट बनियान अंदर पहनता है, करेक्ट जिस दिन पहना उस दिन हाई फाई होता है यहाँ पे, वेरी गुड ऐसे.
Lovely.
तो वो भी उसको अच्छा लगता है कि मैं ट्राई करूं क्योंकि वेरी गुड मिलता है मुझे. दैट वे. सो इफ हर सन इज यंगर, डोंट वरी, हो जाएगा, धीरे धीरे हो जाता है. Just wanted to share
Thank you
this.
so much, ma'am. Yeah, my son is 9 now.
Okay, yeah, he'll figure it out. Don't worry.
Thank you. Yeah.
Thank you, Ravya. Thank you. Yeah, Samsung, what's your name?
Anita
Anita.
Chauhan.
Yeah, tell me. Anita.
This is very the basic question. How to लगेगा? मेरा question ये है कि why does it happen? Why autism happen? And technology इतनी advance हो गई है, still we are having the kids, ultrasound, triple marker, or so many medicine. Still I see, मतलब someday I hope कि when I had a kid with autism, तो मैं सोचा कि चलो ठीक है, at that time it's in 2015. लेकिन technology अब even after 10 years, still there are number of kids getting affected. So टेक्नोलॉजी के मतलब क्या है रीजन, क्या ये स्टॉप हो सकता है या कुछ मिनिमाइज हो सकता है या इम्प्रूव हुआ है, कम हुआ है इसका रेट परसेंट, या कुछ है ऐसा भविष्य में?
So autism क्यों होता है इसका अभी तक कोई रिसर्च नहीं हुआ है. Okay, I think most of us know this, and there's no research behind why autism happens. Unfortunately, the numbers are only increasing year by year.
Yeah.
There could be multiple factors, the stress that the mothers go through, the infertility issues, the artificial way of, fertility, conceiving babies can also be a reason. There's a lot of research going on this, but there's no specific reason of why a child has autism. And right now, I think the thing that totally works is accept it and work towards
I know
it.
that is fine. See, I already accepted it. This is not a. I'm thinking about that. I always think about the technology. We have the AI. We have advanced in everything. Medical research, or the science, or we are landing on the moon, on the Mars. We already done so many things, but still, this is the core issue. So even I'm concerned with the future mothers, not about me. I'm already accepted. I'm happy with that. No, not at all. It's not a big thing for me. We all the mothers who are present here, right? So I'm thinking about the mothers who might be having the kids autistic. Touch wood,
that's the reason.
God forbid. God forbid.
That's the reason I've started this wellness circle, so that any mother who's new or old, who's facing a struggle,
So I want
dealing with a child.
you are the doctor and you've been in the research fields. So you might be aware the new technologies, new advancement in the medical. So we have achieved kind of things, kind of medicine.
So firstly, I'm not a doctor. I'm not a doctor. I'm an emotional wellness coach. And it could be, an area of study for you. Maybe you can sit and research and see, what are the reasons that can be found out. So it's still under research, and I don't think I'm in a position to comment that why it is happening. We all are in the same boat. We are all,
we all are.
And I think when you look back to your journey, everybody has their reason that, why my child had to face this. So anyway, thank you for asking that, Anita. I hope we find out an answer soon, and then we are able to help more mothers with this.
Ah,
We'll
yes,
be
yeah.
doing
For the
that.
future mothers, I'm talking about, not about me. I'm happy with that.
Great. Awesome. Any other questions? Any other shares? Any other questions? Okay. All right. So, so what I'm going to do now is, I want, like I was sharing earlier, there are times when our children do come up with certain behaviors, and it happens once, it happens twice, it happens three times, and you want to hold your patience, all right? And it happens the fourth time. Like, for instance, since last 3 days, my son is irritated for some reason. So when he wakes up in the morning, he will give me one tight slap. When he goes back to the bed, he's giving me another tight slap. Okay. And I think somewhere I know what's going on with him, the thoughts that he's struggling with. But for me, it's getting too much, and in that moment, in the morning when he did that today, I really wanted to whack him back. I really wanted to give him one tight slap, and I wanted to tell him that enough of your nonsense. And I controlled myself. I did say certain stuff, but I really held myself back. And when I look back, when I used to, I used to feel this a lot earlier. My anger issues were a lot more when autism had just happened and my children were really young. So in those moments, I used to completely lose myself. And I would get into these guilt trips and feeling really bad that, I'm supposed to be the caretaker, and here I'm, not taking care of the child. Instead, I'm not able to support the child for whatever the child is going through. Okay. If a child is throwing a tantrum, or if a child is going through a meltdown, it's actually the child who is, um, struggling with the whole thing. But when the child struggles with it, my struggle also comes into picture. And when my struggle comes into picture, and when you end up behaving in a way that, is not appropriate, you do end up, getting too hard onto yourself. You start feeling really guilty, and you start feeling that, oh my God, what am I even doing? Is it even making sense? Why did I, come across something like this? So in moments like that, I want you to know you all are not alone. I'm sure all of you know this. And this is a place where, it's okay if you go through that. You can actually vent and share whatever that you're feeling. And in my experience, the most sanest of the mothers also lose their patience. Our children are here to, test our patience. So the sanest of the mothers will also lose. So in those moments, how to, I'm going to share certain exercises that will help you release the stress. All right. So there is one particular exercise, just I want you to, all of you all, to just think of the frustration that you feel when, your child does not behave appropriately the way you would want the child to behave like. And it ends up building a lot of frustration in you. I want you to bring in a memory or an incident like that and think of it and think about the frustration. All right. Just take a deep breath in, breathe out through your mouth, and think about that frustration or the incident that makes you really frustrated. Okay. And this is an exercise called as tantrum release. And I want you all to do it with me together. If you're not in a place where you can shout, then you can follow me and do it whenever you can. Okay. So the step number one is to locate, there is a, under your collarbone, there is a slight dent over here. Okay. Locate that point. Okay. And tap on that point gently. Okay. This is called as the K27 point. So we tap over here. Okay. The second step is to stamp your feet on the ground simultaneously. While you're tapping here, stamping your feet on the ground. Okay. I want you all to do this with me. Vaishali, if you cannot shout, you can at least tap under your collarbone and stamp your feet. Okay, do that gently. And the third step is to take a deep breath in through the nose and shout out like, ah, okay, 3, 2, 1. Ah! Take a sip of water. And how does that feel? Earlier when I started these seminars, I used to be really nervous. And when every time I would give a demo of this exercise, I used to be relaxed that after this, I'm fine. All that pent up emotions, it gets released. Okay. So, when you stamp your feet on the ground, there are a lot of meridian points in your feet. And this is the K27. This is a kidney meridian. So a lot of fear, anger, and everything gets out. And when you shout it out, you release it. A lot of frustration, anger comes out. Okay. So every time, you can actually just include it in your daily routine, and you all can even make your children do this. Okay. So my son would, he would find it either I stand in front of him and do it, like I'm doing it with him. So he will now imitate me. Or I used to tap under his collarbone and I would say, shout out, ah. Even if they're not screaming, just, gentle ah, the sound that comes out, that also makes a difference. And stamping the feet simultaneously. So this relaxes your nervous system instantly. Okay. And you release a lot of frustration and anger. Okay. So this is one exercise that y'all can do. And yeah, another exercise, there are a few more exercises that will help you release your worry and, relax you completely. So under your eye, there is this, the bone, correct? So just tap on it like this, like cross your hands like this and tap. Okay. So this is the stomach meridian, and stomach basically, holds a lot of worry. The emotion of worry is held in. Dr. Niharika, you can also try this with me. Okay. So if you have any, if you tend to have a lot of digestive issues also, then too you can tap under the eye, because it helps your stomach to relax and it releases a lot of worry. So every time you're feeling worried, sometimes there's a lot of constant overthinking, thoughts coming into your head, and you're not able to do anything about it. So simply tap over here. You'll notice, you will start yawning a lot, and that's a release. When you tap here continuously, you'll start yawning, and that's a release, and it relaxes your stomach. It releases a lot of worry. So yawning is really good. Every time you do, these are all somatic exercises. So the stress which is held in your body, when you stimulate these points, it is released. Okay. So tap under your eye, and you can choose to say that I release all my worry now. I choose to release all the worry now. And breathe out through your mouth, because when we breathe out through our mouth, we relax the lymphatic system. Okay. So this is another one. And the third exercise is, you all can take a sip of water. After every exercise, you'll drink a lot of water, because a lot of toxins come out. So the water dilutes the toxins and it releases. So the third step is like, between your eyebrows, keep your little finger and join all your fingers like this, and the index finger is where the hairline is. Okay. And keeping your thumb near your ears. Okay. Now take a deep breath in and dig all the fingers deep in your forehead. Do it with me. You'll get an idea of how this works. Okay. Take a deep breath in and put pressure and release while breathing out. When you stretch, breathe out through your mouth. Okay. Again, put your fingers here in the center of the forehead. Take a deep breath in and dig your fingers deep inside. And as you breathe out, pull your forehead. This helps in releasing headaches, tension, a lot of meridian points on your forehead. Okay. So it stimulates a lot of organs and releases a lot of stress. So while you're breathing in, you have to dig your fingers deep between the forehead. And when you breathe out, pull your fingers out. Okay. One more time. Take your fingers in deep. Taking a deep breath in, and when you breathe out, yes, that's it. Lovely. Okay. And this is another one that helps in fear. Okay. So your eyebrows, they basically cover the bladder point. So you can hold your eyebrow like this. This is called eyebrow pinching. And you can simply pinch your eyebrow, and it'll pain. Okay. It'll pain a bit, but don't worry about the pain. It's basically releasing all the fear that is stored in the bladder. So pinch your eyebrows and release. And breathe out through your mouth. Let it out. Yeah. That's it. Lovely. Okay. There's another way you can do this is, again, you take two fingers, put it in the middle of the eyebrows. Yeah, like this. So you join your fingers like this, put it in the middle of your eyebrows, taking a deep breath in, pushing your fingers in the middle of the eyebrows and pulling it out. So this is eyebrow pulling. Okay. Again, taking your tempo. Yeah. And when you breathe out, pull your eyebrows out with a lot of pressure. Okay. Yeah. Then you place your fingers here in the center of the forehead. Here where your hairline starts, where the hairline starts. Okay. Okay. And again, take a deep breath in, press hard, and pull it along the hairline while breathing out. Yeah, that's correct. Lovely. It's perfect. While breathing out, pull it out. Okay. So this releases a lot of stress that you're holding on, and it also relaxes your body. Okay. Now I want you to think of anything that frustrates you. Okay. Just think of anything that frustrates you. And I'm going to tap right now. So for those of you who don't know EFT tapping, I want you to tap along with me. So just follow me and repeat after me the words that I'm saying. Okay. So bring into your awareness, taking a deep breath in and breathing out, and bring into your awareness anything that frustrates you. Okay. And if possible, please put it on the chat window or unmute and tell me what is it that frustrates you.
Hi, Sonal.
Yeah, tell me.
This is Trupti, actually.
Yeah, Trupti, tell
Yeah,
me.
yeah. My child is having LD issues, like he
Okay.
has 40% LD.
Mm-hmm.
So my frustration point is he don't sit for the studies very easily.
Mm-hmm.
So that is the frustrating point.
Thank you for sharing, Trupti. Anybody else? Anything that frustrates you? Just pick up anything small. And, my child is not eating, or my child is not wearing his clothes properly. Anything that triggers your frustration, just bring into your awareness and then put it in the chat, or just unmute and share. Writing issues. That's Suchita, right? Food, food pocketing. Okay. All right. Anybody else? My kid repeats statement a lot. Okay. Rashari, you're writing something? Mhm. Just 2 minutes, we'll wait for Vaishali and then we can start. Okay. Anybody else wants to share, can share. And when I start also, if you want to share something, you can either put it on chat or unmute and share it that I'm feeling this. He argues a lot. Okay. All right. So Abhi, I'll say certain statements and I will tap, and I want you all to tap with me and repeat those statements after me. Okay. So even though my child won't study, and it really frustrates me. It's okay. I'm okay. I choose to love and accept myself anyway. Even though there are a lot of behaviors of my child that frustrates me, I still choose to love and accept myself. Even though there are so many behaviors of my child that frustrates me, I still love and accept myself. Okay. Coming to the eyebrow point, okay, where your eyebrows begin over here. So just watch me and follow me, okay? So even though I get really frustrated when my child shows writing issues, food pocketing frustrates me. My child repeats statements a lot and it really frustrates me. My child argues with me under the nose. His argument frustrates me. My child won't study, and it totally frustrates me. Under the collarbone. Yeah. And now we'll tap under the arm on the bra strap. My child really irritates me and frustrates me. There is food pocketing on the thumb, okay? Like on the outer edge of the thumbnail. No, not that side. Like if you place your hand like this, the outer edge of the thumbnail, that is where you tap. Yes, there.
Left or right?
Any hand will do. Any hand will do. No
And
specific hand.
the side of chest also any.
That or any side will do. Yeah, any side. Okay. So my child will repeat his statements a lot. He will not write. My child will argue a lot. Okay. We come on the index finger, on the middle finger, then we skip the ring finger and we come on the little finger. My child and his behaviors frustrate me a lot. Even though I get frustrated with my child's issues, I still deeply and completely love and accept myself. Take a deep breath in through the nose. Breathe out through your mouth, ha, with a ha sound. I'm so sorry. My laptop just, restarted again. So I was logged out and yeah. All right. Did you all take a deep breath in through the nose and breathe out through your mouth?
Yes.
Okay. How does it feel? Share with me. How do you feel?
It was relaxing. Mhm. And I also got some yawns.
Okay. Anybody else? Any better? Okay. Let me also like it. Great. Felt relaxed. Lovely. Okay. So let's do some more, even though. What would you like to feel? Just put it on chat. What would you like to feel instead of feeling frustrated? In the moments, what would be the opposite of it? What would you like to feel instead of feeling frustrated? So if you say better, what are you feeling? Some of you said relax, that is good. But what else are you feeling, or what would you want to feel? Patience, acceptance of the situation. I should feel calm. Okay. Anybody else? Emotionally stable, satisfied. Okay, let's try this. Okay. Even though in the moments of frustration, now just repeat after me, all right? Even in the moments of frustration, I feel that I completely lose myself. And I don't feel emotionally stable. And I don't feel calm. Suppose somehow I could forgive myself. I could forgive myself for the behaviors that I never imagined I could have come up with. My voice is low. You all can't hear me? Yeah. Um, uh, Suchita, I would request you to, increase your volume because others are able to listen to me. So maybe there's something with your device, just check it. So suppose somehow I could forgive myself. I could forgive myself for the behaviors that I did not expect I would come up with. I could forgive myself in those moments when I got equally frustrated and equally stubborn as my child. Forgiving myself, forgiving the situation, forgiving my child, forgiving myself for getting frustrated when I was probably supposed to be calmer and patient. Allowing myself to forgive myself. All forgiveness is here. Life forgives you. Life forgives me. The universe forgives me. Even though I was frustrated and I felt I couldn't forgive myself. I choose to forgive myself now. I choose to move towards emotional stability. I choose to feel calmer in the chaos. I choose patience and I choose to feel satisfied. Suppose somehow acceptance could come to me easily. And I could feel relaxed even when things are not the way I thought it would be. I still choose to love and accept myself deeply and completely. Taking a deep breath in through the nose again, breathing out through your mouth. Taking a sip of water. Yeah. How does that feel? Relaxing? Okay.
Good.
Thank you.
Yeah. I have one question.
Yeah.
Uh, so doing this thing is with both the hands or only single hand?
You can do it with both hands or with the same hand. Any side is okay. Okay, like this, like there's a very forgiving process. We are only tapping on different meridian points. They are related to different organs of the body which hold different emotions. So when you're tapping on all these points and when you speak about your stress, a lot of emotion gets released. Okay. So you all can try. I will take some time and I'll upload these videos on YouTube. You all can try and do the exercises that I've taught you earlier. So I taught the tantrum release. I taught the eyebrow pull, the forehead pull, the eyebrow pinching. Okay, all of these are somatic exercises. They help you release a lot of stress which is stored in the body. Okay, so you can do these exercises. You can also do the tapping sequence whenever you get time when I'll upload this online. And yes, it is like Ho'oponopono prayer. It's slightly different, but yeah, similar. You can also combine Ho'oponopono with this. Okay, while tapping on these points, you can combine that prayer along with it. So great. I really want you all to give me a feedback. If you found this helpful, please share it with more mothers. We want to create a community so that we can support each other. And any topics you would like me to cover, please put it on the chat. You have any questions, put it on the chat. I know some of you had sent me questions yesterday. I will try and take out time and, answer it back to you. And I would encourage you all to put the questions on the group so that, if somebody else also has the same question, we'll also get an answer to it. So that was it for today. Thank you so much for joining. Really grateful.